This is a very brief introduction to fibromyalgia. We're going to talk about fibromyalgia, what it is, fibromyalgia risk factors, the triggers, as well as fibro symptoms. Now, what is fibromyalgia? I know we have many controversies, especially in the recent months, about fibromyalgia being an autoimmune condition. Now, at this time, we do not consider fibromyalgia as an autoimmune condition. We think of that as a chronic pain disorder, an abnormal way the brain processes pain and other stimuli. Now, fibromyalgia is not progressive, meaning there's no organ damage, and it is not a life-threatening condition. Unlike other disorders like rheumatoid arthritis and lupus, if left untreated, they may produce damage to the organs like kidneys or joints. Fibromyalgia may progress in the severity of the symptom over time, but it does not cause organ damage. You may have fibro for 20, 30 years and still have normal labs and imaging. Now, although fibromyalgia cause is not known, we know that fibromyalgia is real. Fibro pain is absolutely real. Fibromyalgia is real. Fibromyalgia is a very common condition. It affects over 4 million US adults, or about 2% of population. 1 in 20 people worldwide have fibro. Now, what are the risk factors for fibromyalgia? Who gets it? We commonly see it in females. Women get it, fibromyalgia more often than men. We see it in middle age, between 20s and 50s, but we also can see it in adults, males, children, and elderly. It is common with other painful condition. So if you have another painful condition such as rheumatoid arthritis or osteoarthritis, chronic back pain, migraines, endometriosis, you may also have fibromyalgia. We see it in families. So there's a genetic component in fibromyalgia, but it's not the same type that we can test for. So we don't have a genetic test to see at this time who has fibromyalgia, like we have tests for genetic conditions like Down syndrome or cystic fibrosis, but we do see an increased number of family members having fibro symptoms. Now, also, people who have recurrent injuries, again, it's likely due to chronic pain as a result of the injuries. We see it as a risk factor. Sleep disorders, sleep apnea, insomnia. Patients who have other autoimmune conditions, about 25% of patients who have autoimmune conditions will also have fibro because those conditions are often painful. We see increase in fibro in patients who are overweight or have poor nutrition or vitamin deficiencies. And we often see fibromyalgia along with anxiety and depression. Now, common triggers of fibromyalgia are trauma, early childhood trauma, physical sexual abuse, neglect is a very strong trigger of fibro. Ongoing or severe stress, prolonged hospitalization, severe infections. We see increase in fibromyalgia now due to COVID infections, due to increase of stress from isolation, as well as post-COVID long hauler symptoms. Also, injuries, car accidents, whiplash, falls, fractures, recurrent injuries, sport-related injuries can be a trigger of development of fibro. So what are fibro symptoms? Patients tell me they have pain. So widespread pain is essential for diagnosis of fibromyalgia. They tell me everything hurts. My body hurts, muscles, joints hurt, even my skin and hair hurt. They tell me I have a good day and a bad day. When I have a good day, my symptoms may be mild or none, but if I have a bad day, I feel like I was run over by a truck. I feel like I have the flu. Everything hurts. Everything bothers me. I have increase in stiffness. I feel fatigued, exhausted. I have the general malaise. Also, difficulty sleeping, sleep that's unrestful, sleeping too much, or difficulty falling asleep or staying asleep is common. Now, problems with memory, thinking, concentration that we call fibro fog is very common. I had a patient who had significant fibro, and she was a professor who was teaching the same course for years and years. And when she developed fibromyalgia, she couldn't remember the course details without looking up the notes. So fibro fog is a common problem. Sometimes you may have such a significant word finding difficulty that you may think that you have stroke, dizziness and lightheadedness. Usually it's episodic, and we have to rule out cardiac conditions and other conditions to make sure they're not causing the symptom. But dizziness and lightheadedness is a common fibro symptom. Now, episodic numbness and tingling is also common. Feeling restless legs or numbness, tingling that spreads from one part of your body to another is a common symptom. Now, patients may have neuropathy, which is persistent nerve pain from nerve damage. That's a neuropathy. But the episodic, especially numbness and tingling that spreads around, it's a common fibro symptom. Headaches, including migraines and tension type headaches, are very common. Sensitivity to touch, smell, bright lights or noise, very common. People feel overstimulated. I have patients who used to love shopping. They used to go to department stores and malls, and now they avoid them because even 30 minutes in the mall will cause increase in their symptoms. They're sensitive to smells, to bright lights, fluorescent lights, to noise of the music, people. So very common symptom of feeling overstimulated. And then there are other conditions that go hand in hand with fibromyalgia. Postural orthostatic tachycardia syndrome, or POTS, IBS, irritable bowel syndrome, painful bladder, interstitial cystitis, TMJ, anxiety, depression, restless leg syndrome. Those conditions, again, they are common in patients with fibromyalgia, and they come up due to abnormal brain processing. Now, this was a very brief overview of fibromyalgia, and I hope we can have additional lectures on it later.